to President Obama's desk, we're still a long way off. Congressman Eliot Engel is a Democratic member of the Energy and Commerce Committee, which is wrestling with several aspects of the legislation, and he joins us now to talk about where we are. Congressman, you were among those who felt very strongly that there must be a government option in the legislation, but that apparently is going nowhere. What then is acceptable? What would you find acceptable?
Well, I don't agree that it's going nowhere. The House, we hope in October, will pass a bill on the House floor, and the Speaker has told me that we will have a public option bill. I hope it will be a robust public option, similar to the bill that we passed, H.R. 3200, in the Energy and Commerce Committee. In fact, I am even for a stronger public option than that bill has, which would tie it to Medicare rates. And the reason I'm for a public option is this. Public option is what it is, only an option. It doesn't mean a government takeover of anything. It's just that people will have a option to choose the public plan, which will have low premiums.
I understand all that. Let me just ask you a question, though. The Senate
also have low premiums.
I don't mean to interrupt you, but I want to jump in here. The Senate has already said public option is dead. If you can't get it through the Senate, it's not going to happen. Doesn't it make more sense to try to find something that all can find acceptable at this point?
Well, I think that will come when the House passes its bill, the Senate will pass its bill, and we'll have a conference committee. I don't think that we in the House should be negotiating against ourselves. We need to pass a bill that we feel strongly about. I respect Senator Barkas. I don't like his bill, but that's only one of the bills. The one will pass another bill. It takes two to tango. It's not going to only be the Senate's way. The House of Representatives, we have our way, and we hopefully we'll put the two bills together, and that will contain some kind of a public option. I think many of us in the House feel very strongly that we need a public option, as I was saying before, because if there is a public option which has a lower premium rate, it will force the insurance companies to compete with it by also keeping costs down. And the bottom line is to help the consumer be able to afford health care by keeping the premiums down.
Congressman, just time for one quick question, and that is, are you surprised at the level of rhetoric and the quality of the rhetoric, which hasn't been very high, on this particular issue?
Well, I'm not surprised, but I'm embarrassed by it. I think colleagues on both sides of the aisle have to be very careful to be respectful to one another. We're all sent to represent our districts. We may have differences of opinion, but we all should respect each other. I've been in the House now 21 years. I can tell you that 98, 99% of the people on both sides of the aisle try to do the best job they can, care about America, and represent their constituents. We ought to stop demonizing the other side, and that goes for both sides.
All right, Congressman, good to have you. Thanks for joining us here on America's News Headquarters.